Horse racing is like nothing I've ever taken care of before. I've taken care of football players, and I've taken care of soccer players, and I've taken care of runners, but horse racing is completely different.
Inside, coming under a handrail was terrible spill, and it's Crimson Ace, oh, a spill.
They absolutely are resilient. I've seen some of the worst falls I could have ever imagined, and they get up and they brush the dirt off their face, and they wash up and they change their silks and they get ready for the next race. The jockeys usually are 115 pounds to 120 pounds. The horses are up to 1,200 pounds. They're usually racing of speeds up to 40 miles an hour. So when a jockey falls, it's a much more higher velocity fall, higher injuries, much more complicated.
Like the jockeys say, you know, it's not if they fall, when they fall, because they know that they're going to hit the ground at least, you know, one time in their riding career.
I don't know, I think I'm crazy, honestly. I enjoy riding horses. It's definitely a dangerous job. Most sports are dangerous, but the thrill of winning is very fun, and I know everybody in there loves to do what we do, you know, ride horses for a living.
On the outside, oh! The 5 lost the jockey there.
When a jockey gets hurt in a race, they want to pretend like they're not hurting because they're afraid they're going to lose that next mount. They want to ride that next horse because somebody else is going to take their business. And if they cannot ride the next horse for a client, then somebody else is going to get into that outfit and start riding for that client. So they're afraid of losing, losing clients and losing money.
This is a different culture.
Go ahead.
Jockeys are athletes.
Go as hard as you can.
They train, and they're very much as much of an athlete. Why not have people who specialize in taking care of athletes be here at the racetrack? Follow my finger with just your eyes. Does this bother you at all? The Maryland Thoroughbred Horsemen's Association came and met with MedStar Sports Medicine, and they said, you know, we're looking for some doctors to take care of our people at the racetrack. And they said, well, what better physicians to take care of the racetrack than people who specialize in sports medicine? So the Horsemen's Health program actually takes care of everybody who works at the racetrack.
What we're trying to do is understand how best to educate the community, the jockeys, the horsemen, and those that support them. We're also trying to find out what kinds of injuries and how long they last and how best to manage them so that we can get the riders back, get them as healthy as possible, and get them to return to ride as quickly as possible.
We see a number of injuries, anywhere from fractures to contusions or bumps and bruises. I see horse bites. I also see a lot of shoulder injuries from falls, a lot of just sore, achy muscles, a lot of arthritis from people that have been walking horses for all of their lives.
The Horsemen's Health team is interested in all kinds of injuries, how to prevent and best manage these injuries in this very unique culture and environment that is the Horsemen's.
But of course, one of the most important injuries that we see here are head injuries. Concussions are a little bit different than orthopedic injuries or a broken bone because not everyone really knows that you are having a head injury.
So a concussion is a head injury where the brain actually has some shaking and trauma to the inside of the skull, and it results in some sensory changes or balance or memory or different nervous conditions that may result from it.
So some of the symptoms of a concussion, of course, dizziness, irritability or sensitivity to loud noises bothering you. You might feel tired. You might feel confused. Our jockeys are now getting baseline testing for concussions as part of their routine pre-participation physical. So when I first meet a new jockey, I'll do a physical on them, go over their concussion history as well, which includes, have they ever had concussions before? Do they have daily headaches? Do they have any other significant risk factors that might put them at risk for a prolonged recovery from a concussion? And I want you to follow my finger in.
The SCAT-5 baseline is something that we've adopted to assess things like their memory and their balance so that we've got some understanding before they were to have an injury of where they are, so that in case they have an injury to the head, we can then have that assessment of where they were and what we want to get them back to. It's very similar to what's done in other sports now, but I think this is very unique to bring it to this sport and this culture.
Which is, a spill there, spill.
I think when we take a spill and something does happen to us, I think what we want to do is get back out there. We don't want to disappoint, the owners and trainers that have allowed us to ride their horses in the afternoon. I mean, they want us to be at their best, so we want to give them our best. A race last year, my horse took a bad step. I ended up falling off mid-race.
Just, a spill there.
Out unconscious for a few seconds and woke up, got treated on the racetrack, and then next thing you know, I'm in the ambulance. Something is not right. I feel like my timing is a little bit off. I feel like I'm a little bit slower to respond. And I think that's, when you're out there, the adrenaline is out there, is in your body. And all you want to do is race and compete, but not until something like that happens where you have no choice but to sit out a few races and get yourself together, do you realize that maybe you're not thinking as quickly as you should be.
Here comes recoil 9.
It's a very fast sport. You have to make split-second decisions, and we have to make sure that the jockeys are in top form at all times to make those decisions so that hopefully we'll prevent an accident from happening.
Third, Leroy Brown settles after his
There's 8 videos from all angles so that we can see if a horse or jockey crosses over in front of another one and actually fouls that rider. You're dealing with a large animal that has a mind of his own that weighs almost 1,000 pounds, and sometimes they're hard to control. But we need the jockeys at 100% to try to control them.
half lead of Just Jack, and Just Jack fell.
If a jockey has a fall or gets hurt during a race, he'll have to go be examined by the doctors. If it's a concussion incident, they've already taken a baseline test for them to ride when they start riding, and they'll have to take that to pass.
Touch your nose, not touch my finger.
And then we'll confer with the doctor whether the jockey is fit to ride, because he has to be 100% to be able to perform. If they had a concussion and were allowed to ride, they might come over in front of a horse, and that horse that they come in front of would be too close, and their legs would touch the legs of the horse in front, causing the horse behind to fall. Then that jockey could be injured, and the horses behind him could potentially fall over top of them. The jockey really has to be quick and sound of mind all the time.
If you are diagnosed with a concussion, or even if you suspect a concussion, it's really important to make sure to follow up with a specialist who specializes in concussions in approximately 2 to 3 days. So once a concussion is identified, it is important to give your brain some rest. You want to make sure that you don't go to any kind of activities, like physical activity, for the first about 24 to 48 hours, just to give your brain a little bit amount of time to heal.
One thing that we've developed recently is a return to ride protocol after concussion. But we've specifically designed it to work in the jockey setting based on their demands for their sport and how they ride, and slowly progress them back so that when they come back to a full racing situation, that they're healthy again, that they don't have any symptoms or signs, or there's not going to be long-term damage if they're going to come back and be fully prepared to get back on the horse and race at full speed. So MedStar Sports Medicine is really invested in developing evidence-based protocols. And for that, we need data to support the approach that we take. So we are now looking to collect data on all the injuries that the jockeys experience, especially concussions, and how those concussions happen, what are the forces that are involved, the helmets that are used and how effective they may be, and then how best to return them and use clinical management and that return to ride protocol to get them back safely.
We're very happy and we're very excited. Between MedStar, the Stronach Group, and the Maryland Horsemen have, they've opened up the doors and they're just making the jockeys more safer.
And they're off to a perfect start.
When you win a race, there's no other feeling. It's a great feeling.